5 things that I would do differently as a patient, knowing what I know as a physician. So I'm jumping on this bandwagon trend as well. So the first thing I'd request my patients to do is check your sources very carefully. So if you look at academic sources like Harvard, Stanford, MIT, or websites of good clinics like Mayo Clinic, Cleveland Clinic, or reputable government websites like Health Canada or the CDC, you will get good reputable information. I sometimes get patients showing me all kinds of weird wacko stuff that they received on WhatsApp, and they really have to be careful when believing that kind of thing. Number 2, I request patients to respect the resources of the healthcare system. Yesterday, I got a report of a patient who went to ER just to get a COVID test. Now that patient could have just gotten a free rapid test at home. There was no need for that person to have extended the already stretched waiting time of emergency room, and probably in the process having had infected a few other people waiting in ER and perhaps a few members of staff there as well. There was just no need for that. Please respect the resources that a healthcare system has. Number 3, please understand that medicine and science evolves. Just because when you were a kid you were given antibiotics every time you got a sniffle or a cold, that doesn't mean that's the right thing to do. So when you approach your physician, please approach with a question and your complaint. Tell your physician what your problem is and let your physician tell you what the solution is. Don't go in saying, I want my antibiotics, because that's how it was done 30 years ago. Science evolves, and we are here to give you the best recommendation for your health. Number 4, just like you take your car for servicing, make sure you go for your annual physicals, get your blood tests done, get your screening tests done, cancer screening, vaccinations. I'm always amazed to see patients when they come after several years of not having had any tests. They're already diabetic. We can also already see damage in their eyes and kidneys. At that time, we are playing catch up. That should have been detected a while ago and been controlled previously. Tip number 5 is for young people. I call them the 4 Ds. Always be careful when delving within that 4 Ds. And that is drugs, driving, diving, and dating. These 4 things can get you into trouble. Be very careful. And bonus tip number 6 is that be very aware of the effect that your diet, lifestyle, sleep, and stress levels have on your health and general well-being.